Hello, everyone, and thank you for joining today's webinar presentation, Increase Revenue and Improve Patient Care with Kareo Telemedicine. My name is Hira Kang, and I'm a Content Marketing Manager here at Kareo. Today we'll be providing a helpful overview about the benefits of adding a telemedicine program and how surprisingly simple it can be for Kareo customers. Before we begin, I'd like to point out some functions within the webinar platform. Throughout the webinar, we welcome you to type in your questions as they come to mind. You can do this by clicking on the question mark icon and typing into the field below. At the end of the presentation, we'll be having a very informative Q&A session, so please be sure to stay with us. And later, we'll be emailing you the responses to all the questions with a link to the recorded webinar and all the related resources. Speaking of the resources, you can access the presentation slides and resource downloads today by clicking the Files icon, which is located under the question mark icon. If you have any trouble with sound or with the slides not moving forward, you can try refreshing your browser window, and if that doesn't work, feel free to type into the question box and we'll do our best to resolve the issue for you. If you're on social media, we encourage you to connect with Kareo on Facebook, Twitter, and LinkedIn. You'll receive industry news and educational resources like this webinar to help independent medical and specialty practices succeed. And now I'd like to introduce our presenter, Sean Brindley. Sean is Product Development Manager for Kareo Telemedicine. He has over 7 years working in health IT development. Before that, he served as a clinical assistant for general surgery. He works directly with private practices to address regulatory support, revenue generation, clinical uses, and patient communication for telemedicine programs. And with that, I'll turn it over to you, Sean. Thanks so much for being with us today.
Great, thank you, Harry. I appreciate the introduction, and thank you again to everybody for joining us today. I hope this session is informative for everybody on the line, and as Hira mentioned, at the end of this quick presentation, we're going to run through a live demonstration of what the Kareo Telemedicine platform looks like, and then we'll have a Q&A session. So please do get those questions in, and we'll do our best to address all of them. Here's a quick look at the agenda for today. So let's go ahead and just dive into it. I'd like to start by discussing the current state of telemedicine. Let's go over a quick telemedicine overview. Telemedicine, really, it's not anything new. It's been around for quite some time, and it actually dates back to the old-style connected telephones, where you had a wire plugging you into the wall. By definition, telemedicine allows healthcare providers to evaluate, diagnose, and treat patients from a remote location. However, with so many new technology advances and the fact that pretty much everybody carries around at least one high-definition camera with them in their pocket every single day, video-based telemedicine is becoming the new standard. It's here, it's now, and it's changing the way healthcare is delivered. When looking at the telemedicine landscape, there's generally 3 buckets today that I like to discuss. So let's go into a little bit of detail about each of these 3 you see on the screen. The first one is called store and forward. Now, I'm not going to spend too much time on this as it's really not a great form of telemedicine and the reimbursement rules are not all that favorable. Essentially what this is a way for providers to communicate with patients through asynchronous conversations and send text messages or still images back and forth. What we're really talking about here is a glorified form of email that doesn't enable real-time two-way communication. The next category is on-demand telemedicine, and there are 4 large companies that provide this type of services to patients. What these companies do is allow for patients to connect with a provider on demand for basic urgent care visits. The patient is placed in a queue and will speak with a provider when they are ready for their appointment. They most likely don't know this provider or have an existing relationship with them. These on-demand companies have networks of thousands of providers waiting to be connected with your patients. At the end of the day, honestly, I think this is leading to some fragmentation of care as it's leading to becoming a source of patient leakage for practices. Furthermore, the providers who are conducting these visits, they don't have full access to the patient's medical records. So it's very possible that the patient is not given the entire scope of what their medical history is or their full medication workup. So at the end of the day, this could potentially lead to some issues, although it is very convenient. Now, one quick example here that I recently came across. My wife recently received an email from her health plan provider branded with her company's logo, and the notice was promoting an on-demand telemedicine service that offered video visits as an alternative to seeing her primary care provider. This is happening today. You may not realize it, but your patients are actually receiving emails from their insurance companies promoting these types of on-demand visits, as it's a very convenient and easily accessible way to promote care. And finally, the third option we have here is practice-based HIPAA-compliant video visits. This is what Kareo Telemedicine enables, and it's what we're going to spend the bulk of our time discussing today. You're able to cut down on patient leakage while providing the best care possible, and at the end of the day, that's really what's most important. So where's telemedicine going? We've coined 2017 as the year of telemedicine, and this isn't meant to be cliche or in conjunction with the launch of this new product that we're announcing, but we've really seen some exciting advancements in the industry. Let's take a look really quickly at these two quotes that you're seeing on the screen from some very reputable organizations. First, over on the left, Kaiser, they expect to do more video visits than in-person visits by the year 2018. That's right, I said 2018, which is absolutely not very far off. So that's very indicative of where we believe the industry is going, as these video visits are appropriate for a plethora of different types of medical conditions to be treated. Second, from the payer viewpoint, we've seen some really exciting advancements around reimbursement. Here you can see Joe Swedish from Anthem mentioning that the opportunity for payers is great. We're seeing very favorable reimbursements from private payers and commercial payers across the board. We'll get a little more into the details around reimbursement shortly, but having the payers be engaged in telemedicine is a strong indicator as to where the technology is going and how disruptive this will be moving forward. All right, so let's focus on reimbursements a little bit here. On your screen now, you can see a map of the U.S., and you can see that there are 33 states currently with a parity law or a reimbursement mandate that requires private payers to cover telemedicine visits just as if they would for a normal in-office, in-person visit. Additionally, in states where there isn't a parity law, we're seeing major payers reimburse regardless, as there's a downstream cost savings. So let's think about it. If an emergency department visit would cost the payer a few $1,000s, whereas a telemedicine urgent care visit would cost about $70. If even 1 out of every 100 telemedicine visits prevented an ED visit, well, that's a major downstream cost savings and an incentive for the insurer. Now, in states that don't have a parity law or a reimbursement mandate, our platform is especially valuable for your practice as we work with you to ensure you're reimbursed for your visits. We've developed a proprietary rules engine to help with this. Again, we'll discuss that in a little more detail here shortly. The private payer reimbursement is extremely important for your practice. So prior to each encounter, we'll run a telemedicine specific eligibility check that ensures you will be reimbursed through private insurance. Of course, we understand that avoiding disruption is key to keeping your practice operating efficiently, so all clinical documentation can take place directly in your EHR, just like you're doing today for normal in-office visits. Regarding coding, typically we see a lot of level 3, the 99213 CPT codes used, and the platform will ensure that all modifiers are correctly coded, keeping you and your practice in compliance. We get a lot of questions around how you can bill for a level 3 visit if there isn't a physical examination. And if you look at the E&M guidelines, as long as you hit 2 out of the 3 components, which of course include discussion of medical history, physical examination, and some degree of low to mid-complexity medical decision-making, the appointment will qualify as a level 3. So obviously in these cases you won't have a physical examination, so as long as you document the other 2, the visit is in fact eligible to be billed as a 99213. For now, we're only seeing private insurances billed, as the reimbursement mandate does not extend to traditional Medicare or Medicaid. Okay, how can telemedicine be utilized? This is a question that comes up a lot when we talk to doctors and practice managers. Honestly, the best use cases that we've seen are for follow-up routine care, where the patient's been in the office within the last, say, 30 or 60 days. Most of these appointments, if you think about it, generally they don't require a physical examination, so naturally they're a great fit to be done via telemedicine. Other use cases include minor urgent care, processing medication refills and adjustments, or reviewing lab results that came back slightly abnormal that don't necessarily require an immediate follow-up appointment. We also see practices succeed with this for remote chronic disease management. Now, it's important when you're thinking about telemedicine visits to try to think about it exactly like a normal in-office appointment, with the exception that you're using a camera to view your patient. I mentioned this earlier, but all documentation and charting is done within your existing EHR where all of the patient's medical history currently exists. Okay, so let's transition to the next section, and that's talking about some telemedicine myths, some common myths that have come up with a lot of practices that we've discussed with. So the first one, this is the most common one, that telemedicine won't work with my EHR or PM software. Well, that's wrong. With what we've rolled out through the Kareo platform, you don't need to implement a new EHR or change your triage or scheduling workflows. You're able to schedule visits just like in office appointments and keep all patient records and charts within the existing EHR. There's really no need to reinvent the wheel or make things any more complicated than they already are. Video visits are meant to simplify things and improve relationships with your patients. Okay, next, and that's that it's difficult to be reimbursed. As we've discussed, this is in fact wrong. It is possible to be reimbursed for telemedicine visits from private and commercial payers. Our rules engine helps you do this day in, day out. 3, that you must do a physical examination. As we just discussed, that is in fact wrong. This is probably the most common myth associated with telemedicine. The types of visits that are best suited for telemedicine, they just simply don't require a physical examination. As we discussed, level 3 visits and occasionally level 4 visits are perfectly acceptable to be documented and billed for these telemedicine encounters. This is something that we see very often with our providers billing. If you're not going to be documenting 2 out of the 3 requirements as specified by the E&M codes, you can bill based on time. And that's that if you're doing 15 minutes of face-to-face time with the patient, which of course in this case is done via video, you're allowed to bill that as a level 3 visit. All right, next myth, and that's that you can't see new patients. While there's nothing stopping you from seeing new patients via telemedicine, I truly believe it's best suited for existing patients where you have that pre-existing patient-provider relationship that you've worked so hard over the years to establish. These visits work best in that case. So we mentioned some use cases earlier, but really the practices that we see most successful with telemedicine are discussing those low acuity visits like going over lab results, refilling medications, and routine follow-up care. If you think about some of your patients that have been taking the same medication for a long period of time, every 6 months or 12 months you have to re-engage with them to discuss their current health before processing the medication refill through the EHR. So a lot of times this is done on the phone. The problem with doing it on the phone, despite it being very convenient for the patient, is that you're not able to bill for your time. So essentially you're leaving money on the table. By converting that behavior to telemedicine, you're able to be reimbursed for your time while still provide the most convenient option possible for the patients. All right, next myth, and that's that telemedicine is too complicated. Definitely a common myth that we discuss a lot with providers and practices. And Kareo has really simplified the workflow for practices by tying the visits directly into the scheduling software. We hear a lot of practices say things like, my patients, they don't like technology, or our patients are older and won't be able to figure this out. Through working with a lot of patients and practices as we've been rolling this out, both simply, they're not true. People today, they've used computers for years and and that's a constantly growing segment of the population. Most people have a smartphone that they use on a daily basis, and with that, video technology is more common than ever. Medical video visits are just like Skype or FaceTime, with the exception it's your doctor or patient on the other end versus your friend or family. Regarding the elderly and saying that they're not comfortable with video technology, well, through talking with a lot of them, we've found that most are fairly comfortable using video visits, as they've used something like Skype or FaceTime to communicate with family or grandkids across the country. Furthermore, we hear from a lot of elderly that they enjoy the convenience of not having to leave their house or spend as much time commuting to and from their appointments, whereas it's something that can be very easily done from their comfort of their home. Last myth that we'll touch on quickly here, and that's that telemedicine isn't secure or compliant. Security and compliance are major concerns for health providers, as they should be. Health regulatory firms have reviewed all of these practices, and it's becoming a standard to use technology for many types of visits. Privacy and PHI should always be top concerns for practices and video providers. Okay, we're going to transition to the next part. We'll go into most of this in a live demonstration, but at a high level, I just want to discuss a couple of things here, with the first being how you schedule a video visit. Essentially, you schedule this exactly like a normal in-office appointment. I'll show you this within Kareo shortly, but you select telemedicine from the location dropdown. That moves the visit over into the telemedicine sidebar, which layers on top of the calendar function within Kareo, and this is where you can see all of your upcoming telemedicine appointments. Next, when you're conducting a video visit, this is something really cool that we're proud of, is this video screen that pops up on top of Kareo. This video overlay will stay on top of whatever screen you're working in. This is where you see your patient, and you can resize this and drag it around the desktop to make sense for your workflow. What's really great about this is that it stays on top of any screen that is currently open. So you don't have to stay on top of the scheduling platform. You can move into clinical documentation or charting and do all that at the exact same time that you're seeing your patient. Regarding payments, at the end of the video visit, you're able to charge your patient the appropriate copay or self-pay amount, just as if the patient was in the office. Now, that's something I've said multiple times throughout this, and that's something that I really do want to reiterate again, that treat these telemedicine visits exactly like normal in-office appointments, with the exception of using a video camera to see the patients. Again, very similar from both the patient's perspective and the provider's. And the final component about the workflow of the platform is the billing aspect for a video visit. At the end of each visit, a draft encounter automatically gets created for the completion of the telemedicine visit. The credit card payment that is processed on the previous screen that we just looked at is included in this encounter, as is the eligibility-based billing recommendation and any medical office notes to assist with the billing claim. So that all goes into here, and that can be pushed through as a normal claim, or if there's any changes that need to be made, those can be made directly within the billing platform, just as you would for a normal encounter. All right, regarding building telemedicine into your workflow, generally we suggest that you start by creating a utilization strategy. Ask yourself a couple of questions, things like, what types of visits do you want to conduct remotely with your patients? What days and times will your patients be able to meet with providers via telemedicine? You should establish clinical protocols specific to your practice and specialty to ensure that everybody on your team understands what telemedicine is best suited for. Once you do that, next comes the implementation of this technology. With this product, it's extremely simple. You're able to activate Kareo Telemedicine with a simple click from the Kareo platform. We'll show you that and discuss that more during the demonstration. And once you request the activation, you'll begin receiving training materials right away, so you're able to begin training while the integration is configured. Generally, this takes place within a couple of business days, and we're seeing practices fully integrated, trained, and ready to see patients within, say, a week or two from requesting activation. And finally, it's important to ensure success by committing to use this technology often and frequently. Ask for feedback from your patients and your office staff, and stay committed to providing the highest level of care possible. By asking for feedback from the people who are actually using this and scheduling the visits, you're able to work with the practice and ensure that everything is being done in the most efficient manner possible. Now, the last section we'll transition to before the demonstration, want to discuss just from a high-level perspective why you should offer video visits. This is a question a lot of providers ask themselves. And the obvious answer is convenience for the patient, but beyond that, generally like to focus on these 3 points here, with the first being incremental revenue. I mentioned this earlier about the phone calls being made to patients to discuss these normal visits like lab result reviews, medication refills. By doing those via the phone, great, it's convenient for the patients, but you're not able to bill for your time. We see this a lot in pediatrics as well, where providers are on the phone with concerned parents all the time, just answering questions, which is pulling them away from their normal clinical workflow. By transitioning that behavior into a scheduled telemedicine visit, you're able to provide a higher level of care by being able to pick up on the nonverbal cues, and you're able to be billing for this time just as you would if the patient was in the office. From a clinical standpoint, of course, easier access to care leads to better compliance with treatment plans. That's pretty straightforward. But these face-to-face video encounters are much more effective than the aforementioned follow-up phone calls. Since so much of communication is done through nonverbal cues, you're much more likely to pick up on this indirect communication if you're able to see the patient face-to-face. So if you're discussing lab results and you mention something and the patient says they understand, very easy to cover that up on the phone. But if you're able to see them face-to-face, you're much more likely to pick up on a perplexed look or some questionable notification they're giving you, and then ask them if they truly understand and go into greater detail. Ultimately, you're providing a higher level of care by seeing the patient face-to-face. And finally, regarding patient satisfaction and retention, by providing video visits, your patients, they don't have to take off as much time from school or work or battle traffic, search for parking, or sit in crowded waiting rooms for these relatively short and routine conversations. We conduct a short survey at the end of each encounter, and we see some great feedback from the patients about how they truly enjoy seeing their provider face-to-face for these routine visits while being able to easily fit them into their existing schedules. And finally here, why Kareo telemedicine? Well, first, it's fully integrated. We understand that avoiding disruption is key to keeping your practice operating efficiently and allows you to continue scheduling visits just like you do for these normal in-person visits. Again, all of your clinical documentation takes place in your existing EHR. There's no need to duplicate notes or recreate the wheel and keep charts and notes in different places. You basically follow all of the same procedures as you do in the office today. Next, regarding our in-house support team. So we have a dedicated support staff who are sitting by the phones and by their computers able to triage and fix technical issues as they arise. Our customer support reps, they can quickly and easily intervene via web chat, or you can simply pick up the phone and call a 1-800 number to solve these issues. It's our job to take care of this, not the providers. So we don't want the providers being technical support agents. We find that a lot of the issues come up have to do with the patients not knowing how to activate their webcam or microphone on their computer. So generally very simple to solve. There's just a couple of configuration options that are the same for most people. So by intervening for a couple minutes on the front end, we're able to save the providers from having to do that during the appointment. And finally, pricing. This is a big one. This is something we're very excited to roll out, and that's very simple pay-per-visit pricing. You'll only pay for what you use. And to roll this out, we're offering telemedicine visits at a flat rate of $7 per video visit. So that means for every video visit that you complete, you're charged $7. And if you do some simple math, it's very easy to come up with a quick positive ROI there if you're being reimbursed between, say, $70 and $100 per video visit. So a great way to add some substantial revenue to the practice while creating a convenient appointment for your patients and, again, providing the highest level of care possible. So at this point, we're going to pause for a second, and I'm going to transition to a live demonstration of the platform. Okay, so we'll start here within Kareo, and we'll pull up our calendar. Now you can see on the calendar, I have a previously scheduled visit that we'll take a look at here. It's exactly like a normal in-office appointment when we're scheduling it. You select the visit reason. We'll say this is a follow-up, but from the drop-down menu, you're going to select telemedicine. When you select telemedicine, you save the appointment, and that triggers the sync between the eligibility rules engine and the telemedicine platform and the scheduling platform. When it's time to start the visit, you simply slide out the telemedicine sidebar that you can see right here. This is the new feature that will enable you to run your telemedicine video visits from within the platform. Now on the patient side, when the visit is scheduled, they'll receive an automated email and text message from the platform informing them about their upcoming telemedicine visit. About 15 minutes before the appointment, we'll send them another notification that it's time to check in for their video visit. And to do that, they'll simply click check in, which will pull up some basic insurance information. This is what we used for the telemedicine eligibility verification, and we're simply having the patient confirm one more time that everything is accurate and up to date. So once they do that, we'll hit continue, and the next step is to confirm payment information. With the payment information, this is what we're using for the copay or the self-pay amount. Just like the normal in-office appointment, there will be a standard copay or self-pay based on the patient's insurance. If they met their deductible, most times there will not be an additional copay required for telemedicine visits, or if it's going to be a self-pay, you can establish the predetermined self-pay amounts for the telemedicine visit. Now, all of this, the funds collected here are deposited back into the account you specified during onboarding. This is simply an added convenience for collecting payments just as you would in the office if the patient was checking in or checking out at the point of encounter. So we'll go ahead and continue here. And the final step is a telemedicine informed consent. Again, very similar to what the patient will sign in the office. They can scan through this and agree to the terms and continue. So now the patient's fully checked in and ready to be seen by their provider. So they'll click Start Appointment, which will place them in the virtual waiting room. Now I want to point out with the video quality here, you're likely going to see some lag. That's due to the screen share program that we're using. Of course, the real video connection is extremely high quality, and you won't see any of the choppy video that you might be seeing on the screen. So I'm going to transition back over to Kareo now, and let's slide out the telemedicine sidebar, and we can see now right here that in the waiting room through the check-in process. So let's go ahead and hit Start Appointment, which brings up the video screen that I mentioned earlier. This is where you'll have the encounter with the patient. So you can drag this around on the screen. You can resize it to make sense for whatever device that you're on. Of course, you wouldn't see me in both sections of the screen. You'd have yourself in the bottom thumbnail and the patient large in the center, or vice versa for the patient. Here's what the patient experience looks like. So once you're finished with the visit, you simply hit this blue complete or the end button at the top, which will pop up the collect payment screen. This is just what we discussed earlier. We can see this patient has met their deductible, so there's no charge. If there was a copay to be charged, it would show here. You could hit done. That will charge the patient. I'm going to hit skip this step for now. And then the final step is the appointment quality survey that I mentioned earlier. A couple of questions for the provider, asking them for some feedback about the visit. They'll answer those questions, and that completes it. So at this point, they're brought back into Kareo. If there is another appointment, we'd slide out the telemedicine sidebar, and we could move into that. Of course, here you can see we don't have any more on the calendar at this point, just as you would for a normal in-office appointment. That's really it. It's very simple, clean, and easy to use. This is a great way for you to add telemedicine functionality to your existing practice without recreating the wheel or adding on or layering on additional layers of technology. So at this point, we're going to pause for a second, and we'll go into some Q&A.
Thank you so much, Sean, for guiding us through this important topic of how practices can start benefiting from telemedicine video visits. Let's see, before we get to the questions, I wanted to take a moment and let everyone know a little more about Kareo. And while I'm doing that, please feel free to enter any final questions into the question box, and we'll get to them in just a minute. So, just a little background on Kareo. Kareo is the leading cloud-based technology platform specifically built for the success of independent practices. Our platform includes a full-featured EHR, seamlessly integrated with a powerful billing engine. In addition, customers can take advantage of the Kareo marketing module. This is for managing online reputation and patient communications, Practices can also choose expert-managed billing services to benefit from outsourcing their billing collections and revenue cycle management needs. Kareo has been honored with numerous awards, including recent acknowledgments as a leader in the EHR space. So if you're interested in Kareo Telemedicine, we definitely want to hear from you. Kareo Telemedicine is currently available fully integrated with the Kareo EHR and practice management platform. So please go to the resource tab during this webinar or after this webinar and click on the Contact Kareo Telemedicine link. Whether you're new to Kareo or already a Kareo customer, we want to hear from you and let you know how you can get started. So now we're going to get to some of your questions. Before we get started, I wanted to, along with Sean, I'd like to introduce Ben Har. Ben is Kareo Product Manager of Mobile and Emerging Technologies, including the Kareo Telemedicine offering. So thank you for joining us here today, Ben. I think actually this first question will go to you. So we have someone asking, can the provider see the patient using a phone and app? So if you can speak to that.
Hi, Hira. Thanks for the introduction. Yes, so as Sean kind of mentioned in the presentation, part of the emergency video visits is that everybody's carrying a high-definition camera with them, and that's typically in the form of their mobile phone or iPad. So what we've released with Kareo Telemedicine is a patient-facing telemedicine app. So if you were to go into the App Store and just look up Kareo Telemedicine, you would see that there's actually a mobile application in the store there. And the experience on the patient side is essentially that when they get their appointment reminder that they should be joining or checking in for their appointment, if they're doing it from their mobile phone, it'll actually just prompt them to download that application, and then they can actually see their provider and conduct the whole visit right from that mobile device, which is really convenient, and it really lowers the barrier to entry for a lot of folks. And as we probably know, there's many people who don't really even use traditional desktops normally anymore, or regularly, I should say. And on the provider side, the mobile application probably wouldn't be the best or most stable way to kind of like present that video. So on the provider side, we recommend and train that you would use the Kareo platform to basically conduct those video visits.
Great, thank you. Let's see, Sean, we have a series of questions about reimbursement and also collecting copays, so maybe you can speak to this. We have someone asking if CPT codes 90837 and 90791, if they're being reimbursed. And then just kind of unrelated but somewhat related, someone is asking, shouldn't copays be collected before the appointment? So maybe you can talk about the process.
Sure, two great questions. So regarding CPT codes, there's no limitation to what CPT codes can and cannot be reimbursed for telemedicine. In general, as the provider, you're able to determine what the appropriate billing code to be done for the appointment is. Having said that, there are a lot of ins and outs and requirements that vary based on state in terms of which plans will reimburse for telemedicine. So I can't give a black and white answer as to, I don't know off the top of my head if those two CPT codes are eligible for reimbursement. That's something that I encourage you to follow up with us afterwards so we can discuss that on a one-off basis. However, I do know for a fact that the most common code we see billed is a 213. There are many, many other codes that we see providers successfully bill for. I'm just going to have to follow up on that one after the fact, so please do get in touch with us. Regarding the second question about collecting the copay, great question. So the reason that we technically do the charge at the end of the appointment is because if it's going to be a self-pay patient, like say you scheduled a 30-minute counseling session that ran 60 minutes, you can actually charge whatever the relevant charge is at that point at the end. Before the patient is allowed to enter the appointment, though, we verify that the credit card is valid. So technically the card's been checked out and made sure that it's a real card before the appointment happens, and just the simple charge is happening after the appointment is completed. If the patient doesn't enter a valid credit card, we won't let them enter the appointment. So it's a way of protecting you to make sure that they're not jumping ship after the appointment happens and not paying their copay.
Excellent. Thank you. For this next question, really great questions, by the way. Thank you so much out there for participating. I'm going to just give both Sean and Ben a chance to talk to this. We have somebody from a psychotherapy office, mental health, and they're asking, can we, and probably how, can we use Kareo Telemedicine for psychotherapy for mental health? So maybe, Sean, you can start by saying, letting us know about how we support mental health practices, and then maybe talk a little bit more about our support.
Sure, it's a great question. Now, again, when you're looking at what types of appointments that you want to offer, as the provider, it's up to you to determine if it's acceptable or appropriate to be done via telemedicine. When speaking with a lot of mental and behavioral health practices, we evaluate the types of appointments that we're doing and make that determination with them. If there's anything that you're doing that doesn't involve a physical examination or checking of vitals every time, then chances are it's definitely a good fit to be done remotely. Regarding medications, just, if you're doing your medications via e-prescription, you're able to assess the patient via telemedicine on the remote video visit and then follow the same standards that would apply for e-prescription. I know this sounds redundant as I keep saying it, but try to think about the telemedicine visit exactly like a normal in-office appointment. And if there is a visit where you're actually not laying hands on the patient or don't have to do the physical examination, chances are it's a good fit to be done remotely via telemedicine. We see a lot of remote therapy done, remote counseling sessions, or just checking in with patients to discuss their medications and see how the treatment is going and how they're feeling in between the in-person sessions.
Yeah, thanks, Sean. I think that was a pretty good answer. I don't know if I have too much to add. I just think to kind of go back to, I think, the intent of the question, which is maybe for psychotherapy practice, how you make it started, or it's kind of like more of the first steps, like how could we use it. I think really not just for psychotherapy, but for any practice, I think just, Sean earlier showed a slide of kind of like the common reasons that telemedicine visits are used and performed. I think it's really helpful if you kind of just pick one that's relevant, that's like very entry level, that maybe you can do 1 or 2 a week, because there's going to be some involvement where your staff, you're going to have to kind of like identify patients or scenarios or types of visits that for your practice you think will be fairly low friction, where you want to just kind of start and try using this. And I think that's probably relevant across the board. So in psychotherapy, it might be that you have specific cases with specific types of patients where you see them frequently, but there's a potential that maybe one of those counseling sessions in between 2 others could be more of a check-in. It doesn't really facilitate them having to come in. That would be kind of a good way for you to like start, where you just identify a single use case. And your first month or 2 of doing this, everybody will get used to scheduling these. You'll get used to, for when patients kind of ask about these, the explanation and the scheduling process. That'll all kind of like fall into place. And so that in general, I think for any practice is a good way to start, is to kind of just pick one way. And as things go forward, patients will kind of request it. You'll kind of notice that patients will ask, hey, do you also do this? Can I also see you for this? Can I do this remotely? So it kind of like cascades in that way. Hopefully that answers the question.
Excellent. Thank you so much. Okay, Sean, we have a series of just kind of I would say kind of technical questions, but I think they could apply. A lot of other people might be thinking the same thing. So we have a question about, are telemedicine visits capable when the doctor and patient are in 2 different states? And maybe I can just tack this on. Is this only for U.S.? It's not for international.
Great questions. So regarding the patient and the provider being in a different state, we see this come up a lot, especially in the Northeast, when a lot of the states are smaller and it's very common to be crossing state lines. Generally the rule that applies is that the provider must be licensed in the state that the patient is a resident of. So if providers are licensed in multiple states, they are then able to see patients remotely in different states. We do have some providers, we've come across some provider use cases where they might connect with a patient who's on vacation. So if the patient is out of town and they get sick and they want to connect with their provider, they can call in, schedule a visit, and then visit with the provider remotely while they're out of town. But again, just to reiterate, the general rule is that the provider must be licensed in the state that the patient is a resident of. Now, regarding the international use cases, at this time, this is only available in the United States. This is something that could potentially be offered internationally in the future, but due to the security requirements and the way the platform is established and built at this time, this is something that is currently only available in the United States.
For now, stay tuned. Okay, so another kind of practical question, are these visits Medicaid and Medicare eligible? And I'll just kind of, Sean, this is for you too. So we have someone asking if PAs and NPs providing video visits will receive the same reimbursement. So if you could
Sure.
talk to that.
Yeah, so regarding Medicare, at this time, traditional Medicare is not reimbursing for telemedicine visits. The CMS guidelines don't apply to telemedicine reimbursement mandates at this time. However, if the patient has a Medicare Advantage or replacement plan, those are treated just like commercial or private insurance, and in the most cases, those will in fact reimburse for telemedicine. Again, this is where our eligibility rules engine becomes especially valuable, as we'll do a verification for each patient's plan prior to the visit and focus on reimbursements. Regarding Medicare, I think I mentioned this earlier in the slides, but we see a lot of providers where if the patient's primary coverage plan is traditional Medicare, to offer a standard cash rate for the appointment. And we're finding that most of the seniors are perfectly fine paying, $30, $50, even up to $100 for the convenience of the telemedicine visit, as they don't have to travel or leave home, and it's just an incredibly convenient option for them to be seen by their doctor, especially if they have a lot of recurring appointments. This is something that they can, fill in for other types of visits periodically. Regarding Medicaid, the rules vary state to state, so that's something that we'd have to take a look at your specific location after the fact, after this call. There are a lot of different guidelines that apply around rural or underserved areas, so geography comes into play there. With Medicaid, of course, you are not able to charge a cash rate if the plan will not apply. That's not something that you're legally allowed to do. So a lot of times, if your practice is 100%, Medicare or very heavily focused on Medicare or Medicaid, some of the telemedicine visits might not be a great fit if your strict guideline is around reimbursement. So again, these are things that I can't give a black and white answer for, as it really does vary so much state to state and case by case. So if this is something that interests you, please do get in touch afterwards and let's have a individual conversation to assess your specific needs and figure out how this can work for your group. The second part of that question, if I remember correctly, was regarding mid-levels, if PAs or NPs could run and be reimbursed for telemedicine visits. Short answer is yes, absolutely. That's a great way to add telemedicine visits. We have some practices that will have a mid-level focus on these visits periodically throughout the day. Maybe they'll carve out 2 or 3 hours at the end of the day to run through all of the medication refills, or to respond to any of the questions that were left on the voicemail system from the office. The PAs and the NPs are able to bill and be reimbursed for these just as if they would in the practice. So that's a great use case for most practices to get started and start running telemedicine visits, and maybe assign one of your NPs or PAs as the designated telemedicine person within the practice to start running the visits for a routine set of appointments.
Great, thank you. We have another participant asking, this time maybe Ben, you can speak to this. They're very excited about telemedicine. They want a little bit more information about so once the visit is completed, is the encounter created immediately and automatically? Maybe you can talk about kind of that process that happens. So they're asking if it's, they're excited about the idea that it's completely paperless.
Sure. So I guess for those on the call that are not current Kareo customers, some of this lingo might be a little bit foreign. Just because I'll be kind of answering this question more in line with what happens in our billing application today. So just a forewarning there. But so basically what happens is after the collect payment screen that Sean showed, at that moment we basically will automatically create a draft encounter. And the reason why we wanted to create that draft encounter is a number of different reasons. One is it's when the patient's not with you in front of the office, some of the normal workflows that are kind of supported by the physicality of being in the office are more difficult to facilitate. And so we wanted to make sure that none of these things slip through the cracks where you kind of have missed encounters. And so by automatically creating it, we are able to include the payment there. So the payment that you took, whether it was a self-pay rate or a copay, is automatically received. And in addition to that, it doesn't put the burden of potentially billing for the visit on the clinician at that moment. And normally, you would do your clinical note-taking, and then afterwards you would generate a super bill and then send that over. In this case, that's actually not necessary. So the encounter gets automatically created, and it actually shows up on the Kareo PM side with a placeholder CPT and a placeholder diagnosis to be added. And underneath that, medical office notes, we would show the eligibility-based billing recommendation. So the whole idea here, the focus on why we wanted to do that was really just on we don't want any missed encounters to fall through. That's a great way to not have a good experience with telemedicine is if you don't get reimbursed. And so that's the primary reason for that.
Okay, thank you, Ben. We just probably have just a few more questions left, but this one's kind of important. Sean, if you could speak to someone asking about HIPAA. Are patients forewarned about HIPAA? For example, if a patient decides to video conference in an unsecured area with an audible distance of others, what is the liability to the provider?
Yeah, great question. HIPAA and security are of most concern and for all practices, and something we take very seriously too. In that informed consent that I showed, the third step of the check-in, there is information in there about HIPAA that the patient agrees to prior to starting the appointment. Generally, before a telemedicine appointment happens, as part of the educational phase for the patient, we suggest talking to the patients and letting them know, it's like, listen, we're talking about sensitive medical information, probably not something you should be doing from a Starbucks. If it's, discussing your medicine just as if you wouldn't expect to have your in-person visit during the, in the waiting room setting, it'd be in a private room. So if you're doing this from school or at an office, move into a conference room or some private or secure location. So a lot of that comes down to educating the patient, and for the most part I would say that this is generally common sense for the patient and not be discussing their sensitive information in the presence of others. However, to protect the practice, there is a disclosure in that informed consent about HIPAA requirements for the particular telemedicine visit.
Gotcha, thank you. Let's see, so we have people asking how they can start and how quickly they can start. So this is very exciting. I just want to reiterate that Kareo Telemedicine is currently available for those using the Kareo platform, and we would really love to hear from you whether you use Kareo or not. So on your webinar platform, if you click on the files icon, you can have a contact Kareo, there's a contact Kareo Telemedicine link, so you can go ahead and send us your information, whether you're new to Kareo or whether you're currently working with us. And we'll definitely get back to you with more information. We have received so many great questions. I wanted to let you know that we're going to pull them together and send out complete answers to all your questions by email afterwards, along with a link to the recorded webinar, to all the resources available today, and the information about how to get in touch with us to get more information. I want to thank Sean and Ben for being with us here today. Thank you for this information. And I want to thank all of you who've joined us. We encourage you to go to kareo.com/resources for more educational tools and content. And we look forward to connecting with you again at the next webinar. Thank you, everybody.